For some people, surgery might be your last hope. It feels like it's your last hope. It's like the final thing you need to do to get better, right? And then it's going to be your miracle answer. You think this way before the surgery. You think that it's going to get rid of everything that you want it to get rid of. And then you go have the procedure, and maybe after the procedure, it's not what you thought. And maybe you still have symptoms that you're suffering from. And maybe they're saying, have another surgery, right? Or let's go remove scar tissue from the surgery, or all these types of things that are out there. And there's so many people like you that are suffering. So I've been at this for almost 30 years, and we have a completely different approach to the body that I more than likely you've not heard about. And it's mainly about keeping your brain connected to your cells. And I think you're going to really enjoy this conversation, and it's going to open your brain to possibilities that you maybe didn't ever think about. And literally, it's just going to give you hope. And I want you to understand this is not about blaming anybody. It's literally about educating you on other methods, other techniques that you probably are unaware of, to give you the hope that you need.
Today I'm with Dr. Cormier, and we are going to be talking about failed surgeries where you were trying to get help but did not get the results that you possibly wanted. So hello, Dr. Cormier, how are you? So we'll start off today. When people say a surgery is failed, what does that actually mean in real life?
Well, so many people will have particular surgery, and let's say it's a neck surgery or a back surgery, for instance, and they want results. Maybe they go in with the surgery thinking that they have all this pain and discomfort, maybe weakness around those, wherever the pain and discomfort is, and they come out of the surgery thinking that that's going to be the miracle cure, and sometimes they're worse after the surgery. And oftentimes that leads to another, and they end up on a path that is not, where they're not happy for so many reasons.
Yes. How often is surgery labeled successful in scans but unsuccessful in the body?
Yeah, so examples, we think a lot different than everybody else. And here's a good example. They often do surgeries on pinched nerves, right, in the spine. And so many people have pinched nerves, right? So many people have disc issues. And people literally think it's the disc. But there's an energy flow through that nerve that you can't see on an MRI. So in other words, there can be a pinched nerve, and it can have energy flow fine, and the person have no symptoms at all. But then there can be an unpinched nerve, and there's no energy flow that you can't see on MRI, and that person be paralyzed. So dysfunctional nerves are not just about being pinched, it's about the energy flow flowing through them. And so that would be an example where they thought the cause was a disc poking on a nerve. They go do a surgery and they come out and they don't have any results from the surgery. They feel the same or different, or not any different.
Yes. Why do some people feel worse after surgery instead of being better?
You want to think of it, I mean, there's so many reasons for that, right? Just number one, there's anesthesia that's numbing you. Number two, they're cutting you open. So there's risk with the anesthesia that you're going to have a reaction, right? Some people have reactions. I'll never forget, before I got into this field, I was in another field where I went into it. I was thinking about being a surgeon when I was at LSU, and so I would work in the surgery department in one of the hospitals when I come home for the summers. And we were in surgery one time. Got finished with this guy. He had a neck surgery, and he had a halo where it's like these rods that they used to put in to hold the neck in place after surgery, after a fusion. The guy was probably my size, whatever, and we're in the recovery room, and this guy he comes out of anesthesia. We're waiting for him to come out of anesthesia. He comes out of anesthesia like the Incredible Hulk. I'm telling you, he ripped his IVs out. Some of the screws from the rods that were there, he ripped that out. It was unbelievable. I've never seen it. It took like 10 of us to finally sedate him and get him back into another surgery. And I'm thinking to myself, I don't want to do this. We had other examples where I saw, it was a medical doctor, I never forget, and he was a diabetic, and he didn't take care of himself properly. his nerves started to die in his feet. So he was walking around barefoot in his garden, and his foot got infected. Didn't pay attention to it. By the time he came to see me and the orthopedist, you could see through his foot. And I'll never forget the smell of the gangrene coming out. And I helped the next day with the surgery. We chopped his leg off, the surgeon did. And I'm holding the bag, get the leg in the bag, and I have to bring the leg up. I'm in the 19-year-old kid in an elevator, and I got a leg in a bag, and I'm going to the lab, and the lab's all excited that they got their leg. And I'm just thinking at that point, I want to help people keep their legs, right? I want to help people avoid these types of surgeries. And so that's kind of where my mindset started to shift from those things.
Can pain, weakness, or nerve symptoms continue even when the structure looks fixed?
Yes, absolutely. That's exactly what I alluded to earlier. So your brain is here, your spinal cord runs all the way down. There's 88 primary nerves that come off the brain and spinal cord. Those 88 nerves, they power up every single cell in your entire body. So they're wired to all the cells, which is fascinating. And we talk about how God's engineering is. It's unbelievable. So those cells, there's an energy flow to and from the cell from the brain that should be there. And unfortunately, there's so much interference nowadays that energy flow will sometimes, from a stress you encounter, it's like you're losing power from the brain to a part of your body. Maybe it's a group of cells, and those cells start crying out, and then you get pain, you get discomfort, you have all the things that are associated with it. So from our perspective, we have a method where we can restore power through that line back to the cell. And just taking pressure off of the nerve sometimes can be necessary, but oftentimes it's not.
Yes.
So in fact, if we did MRIs on everybody's spine that's, let's say, 45 and above, we'd find disc issues on everybody all over.
Are certain people more likely to struggle after a surgery than others?
It's dependent on, obviously, the surgeon. It's dependent on the person having surgery, their sensitivity to any of the drugs that they're going to give to them. It's dependent on their how strong their nervous system is prior to having somebody cut you open, because obviously there's risk of infection. There's all kinds of things you can get from a surgery. Oftentimes people go in to have a surgery, they're fine, and end up dying from the surgery, right? Or they come out and get a massive infection, or they have reactions to the anesthesia. There's all kinds of things that can happen.
Yes. Why are patients often told the surgery went perfectly, even when they don't feel so good afterwards?
Well, it's when you're a surgeon, you do surgery, right? So that's what they do, and in their mind, when they go in and take pressure off a nerve, well, then that nerve should function. It should be fine, right? But oftentimes, if they have, we've seen it already where I had a case one time, and the guy came in, he had tremendous back pain, and he had a paralyzed leg to the point where he was walking with a cane, and he could barely walk. And he had one surgery that didn't help, where they took the pressure off the nerves, and they're like, "Oh, you're good," right? And he wasn't good. So then they did a fusion, where they fused L1 to S1, his whole entire lower back. They fused it all together, and they're like, "Oh, now you're good." And he wasn't good. He even got worse, where he got weaker. And so luckily he came to see us, and I will never forget, on his second visit, we had him walking down the hall with no cane. So it's possible with energy flow. You just have to know what to do to restore it. And oftentimes, from an MRI perspective, things may look perfect. We've literally seen cases where their MRI was perfect, but they were paralyzed. And we were able to restore it a lot of times just through energy flow.
Amazing. What happens when someone is told there's nothing more we can do?
There is, and it's almost like there's a whole nother dimension that exists. If you think all the healthcare is just in conventional and maybe a little bit on the alternative, there's a much bigger alternative side than you're aware of. And that's where we've been at it now. I've been at it for 27 years. We've made so many discoveries in that time frame of just trying to get the best, and literally just trying to get people results. Yes. We just want people to get results. That's it. Without drugs, injections, and surgeries, as much as possible.
Yes. Why do pain, stiffness, or nerve symptoms sometimes continue long after the surgery?
Yeah, so there's so many reasons for that. Number one, when they cut anywhere, they're cutting a nerve. That's crazy to think about, right? And I say that they're cutting a bunch of nerves. Because remember, even if I just cut a tiny little section of my hand here, well, that might be a million cells. It's interesting to think about.
Yes.
And every one of those cells is wired to my brain. So when I cut something here, I'm cutting through nerves. So after that surgery, you have to wait until your body tries to heal and regenerate that area that's been cut through. Even though, let's say, whatever surgery they did helped maybe the area that needed it. It could be a bone fragment that needed to be removed, right, or something like that. But that fragment maybe is gone, but yet the person still has a lot of symptoms after, or it takes them a long time to heal. We help on all those levels because we can help restore the power to that area. Even if let's say surgery is necessary, we can help surgery recover quicker because we're helping to get those cells to heal the fastest way possible. But oftentimes, I will tell you, it's not necessary in many cases where you think it is.
Mm-hmm. Why can the body feel worse once the anesthesia wears off and never fully bounce back?
Yes, sometimes you can take a drug and it can knock off certain power to certain cells. It's almost like kryptonite, right? You want to think of like Superman and kryptonite. Some people can't touch a shrimp, and that's like a kryptonite for them, where their nervous system is saying, "Oh my goodness, I'm about to crash by touching that shrimp," right? And then some people have that same aversion when it comes to a medication. It can literally kill people. Yes. Sometimes it does. Unfortunately, I hate to say that, but that's the reality. So when it comes to these anesthesias, it's obviously something strong that's knocking you out that can cause lingering side effects.
Yes. Many patients are told everything looks good, but why doesn't the body agree?
So there are hidden weaknesses that most people don't think about, and even conventional doctors definitely don't. And in my world, really, it's just about keeping the brain powered to the cells. So you can imagine that methodology. It's taken me all these decades to figure out methods to test. There's 88 nerves that come off the brain and spinal cord, and we literally have tests where we can test groups of those cells throughout your body to see if the brain has power to it. And if it doesn't, we have methods to restore it.
Wow, amazing. When someone comes to you after an unsuccessful surgery, what do you notice right away that imaging doesn't show you?
Exactly what we're speaking of is energy flow. That's what we do. So as soon as they walk through the door, we start to put together a full understanding of that person, a holistic approach, like meaning we want to know all the physical stresses they've been through in their life, the emotional stresses, the environmental stresses. We want to know kind of why they had that surgery, what was it involved, how do they feel before, how do they feel after, is there lingering side effects from the surgery? And then we go through a very thorough neurological exam where we examine all the 88 major nerves. And it's almost like getting your brain to send power to all these different parts of your body to see if it's working. And you can imagine how hard the task of your brain is to, like, one power company for trillions of cells. It's impossible to keep one power company powered up to trillions of houses. There's going to be power outages, and there's so much interference our body comes into contact with on a day-to-day basis that's kind of how these things start in the body.
Yes. Why does the nervous system stay in protection mode after surgical trauma?
Yeah, so we have two sides of the nervous system. We have a sympathetic and we have a parasympathetic. The sympathetic is protection, right? So when it's like a survival mode that you have, fight or flight. And the parasympathetic is calming, healing, relaxing, digestive. So obviously, if you go into a surgery, let's say you're somebody who doesn't like conventional very much and you got to go have a surgery, well, it's trauma for you to have a medication. Because you maybe don't agree with it, right? It's trauma for you to get cut open. It's a lot to go through one of these procedures. They make it seem like it's nothing, but it's an awful lot to go through one of these procedures. And after the fact, certainly that sympathetic side of your nervous system can stay worried and like, am I gonna recover from this? Why is it healing slowly? Why do I still have pain? Why didn't it feel better? Why am I still paralyzed? Whatever the symptom may be.
Why does the body react before logic, reassurance, or rehab exercises help?
So the body is designed to heal itself. And big pharmaceutical companies really don't want you to know this, but there's this innate God-given ability for every single cell to heal itself. And I always use just a standard example would be, if I cut healthy cells anywhere in the body, it's the most miraculous thing. We take it for granted, but you literally look down one day and you have a cut, you look down another day and you don't even see where the cut was. That's how a healthy cell will heal. But if you have an unhealthy cell that gets cut, maybe it takes longer to heal and it has a scar because the body struggled to heal it. And then if you have another cut that maybe is in dying cells, maybe they never heal. Maybe that cut never heals. So that's kind of how these things are designed. Our body is designed to heal itself, and it should heal itself, right? And that's why some people maybe have a surgery and they recover, boom, and they're good. And then other people will have one and they don't. It's because those cells in that area, there's still other underlying factors that weren't addressed.
What starts to change when the nervous system finally feels safe enough to heal?
So people just come back to life. It's the funnest, or not, that's not a word. It's the most fun part of my job. It really is, because you get to see results every visit. So like when people come to see us, let's say a person comes in and they've got 10 out of 10 pain, we're able to get that pain down by connecting the brain, finding where it's disconnected. We're able to get that pain down 50% in minutes.
Wow.
And we're doing it not because we're healing anything, it's because the body heals itself. All we're doing is restoring the power back to those cells, and then the body starts trying to heal, and people get better. And so oftentimes we see 10 out of 10 and people go 0 before they leave. It's truly amazing, the power of the human body.
Failed surgery is often blamed on scar tissue or bad luck. How often is there much more going on?
Yeah, so it always, it's mind-boggling to me when somebody has scar tissue after, and I just kind of interesting, I just brought that point up, is some people will get a surgery, not much of a scar. It heals quickly, it's not very much, and other people will get a surgery and it's a bigger scar, takes longer to heal. That would be examples of cells that would cut through that were not healthy. And then, like I said, some people get a surgery and it never heals, or it gets massively infected. And it's those areas, just the way we address it is so different than everybody else. It's just literally trying to take the body and shift it into the self-healing, higher level self-healing that it needs to go.
In your experience, how much does fear, stress, or medical trauma slow recovery?
Yes, so that shifts you over to that sympathetic side. Remember, you have a parasympathetic side and a sympathetic side. The sympathetic is not on the healing side. This parasympathetic is on the healing side. So when you don't have the results you want from a surgery, you can really be shifted. I think one of the worst cases I ever saw, the guy had like 17 surgeries before coming here on his neck and back, and was just in awful shape. And we were able to help him greater than any of those procedures combined. So in fact, we'll have him on one of our podcasts.
Oh, amazing. Yeah. No, I'd love to hear about that one.
Just one more thing.
Of course, go ahead.
His last surgery got infected and in his neck, and they ended up cutting a crater. They brought him back for another surgery and cut the infection out. So he had a crater in his neck. You could almost, like this, not far from where you're touching the spinal cord. Unbelievable.
Wow.
Yeah.
What happens when treatment focuses only on the surgical site and not the whole system?
So exactly kind of what we talked about earlier. If we're just focused on one pinched nerve with a surgery, then that surgery is not, that nerve that could be, that they're trying to unpinch. There might be 10 other nerves causing some of the symptoms they have in that area that need the energy flow restored that they don't think about. You have to literally think of this is like a big breaker box, and there's 88 major breakers. Some are more important than others, And you got to factor all that in when you're looking at somebody's overall health.
Yes. Why can repeat surgeries make outcomes worse instead of better?
Again, it's traumatic, right? It is. They sell it as not traumatic, but it's traumatic to go have all that anesthesia, get cut open again, have the potential that you're going to risk an infection, whatever else. There's some surgeons that wait until they'll say you'll know when you need it, because they kind of guide them in that way. And then there's others that are more aggressive that maybe do 5 surgeries before that. It's kind of just varying, I guess, in what their discretion is as a surgeon. But from my perspective, what I try to do with my body is I want to minimize how many I have, if I ever have any, right? I always tell the story, my dad had his first back surgery when he was 19. So, and then he had another one, and it just led to all kind of other conditions. In my case, and I guess I could tell that story a little better, but the nerves in the lower back also go to the pancreas. They power up the pancreas and the kidneys. So my dad's nerves got so bad that had a couple of surgeries, and those nerves powering up the pancreas, well, the pancreas started to fail. Then he got diabetes, and then that he didn't take care of himself enough, and then ended up his kidneys started failing. So he had a kidney transplant when he was 59. So I don't want to get on that path, and I've done everything I can. But I remember being 19 years old in college, and my back gave out, and I couldn't walk for 2 weeks, right? And since that, I've been on a mission to not have this in my family, and I've done so much. I've never had meds, injections, surgeries for it, and we figured out ways to fix it. So my back's probably better now than it was when I was 19.
Wow. You work with frequency-based therapies in post-surgical or chronic pain cases. What is the body responding to?
Yeah, so frequency is one of my favorite things. Einstein said frequency is going to be the future of medicine, and he was exactly right. So frequency is the tune of your cells, right? So every single cell in your body has a resonant tune, and it basically is like a guitar string. So if a guitar string is tuned properly, a musician can tell in seconds. And then if it's not tuned properly, they can do adjustments to tune it up. Same happens with our cells. If your heart cells have a different tune than your pancreas cells, than your kidney cells, than your femur cells, than your quadricep cells. They all have different tunes, and they need to stay tuned up. When they start to lose their tune due to interference, like environmental stress, physical stress, emotional stress, they can start to lose their tune in any given part of your body, but then they can't do their job. And so they need to be tuned up. So we have all kinds of really amazing things nowadays, devices as small as this that literally fit in your pocket, that can tune up specific areas of your body in minutes. It's the coolest thing.
Why are post-surgical patients often extremely sensitive to aggressive rehab or repeated interventions?
So their nervous systems in general are weaker. Their brain is not as powered up to cells, and they've lost a good bit of power. And basically, the more disconnected your brain is to your cells, then the weaker you are, and the more vulnerable you are to getting more conditions. Bacteria, viruses, fungus, parasites, all that stuff will be more attracted to you because you are weaker. And that's why people will go in. The guy I was talking about earlier, when that last surgery he had got infected. Well, I mean, he had so many before, wasn't getting results, and was weak to where those types of things can happen.
What happens when the nervous system receives signals it no longer needs to defend against?
So the nervous system, when the cells are connected properly to the brain, everything should work perfectly in the body. But when the cells are weaker and they lose the connection, then they can't communicate properly with the brain, and that's when bad things happen. That's when heavy metals can go and get in there, or toxins or microbes like we just talked about. Those cells get hijacked. The weaker they get in your body in any part, they can get hijacked, and it could just be pain all the time. You're hurt all the time. Well, those cells, something's not right with those cells. They're crying out to the brain, and you got to get somebody to reconnect things to get things better.
Why do so many people feel dismissed once surgery is labeled successful?
Because they still have issues. They had that procedure because they expected results, and then they come out of the procedure sometimes and don't have results, or maybe they have some results but not the results they wanted, or maybe it's just slow, like it's just taking forever, and they just keep saying, oh, it's going to take 12 months, right, 15 months to get better. But what they don't realize is there's so many factors that they've not addressed that they could have addressed to speed the whole process up.
What does that reveal about how misunderstood recovery is?
So if the nervous system is connected properly to the cells, let's say it's a shredded ACL, right? Well, I could work on the connections there, and you're probably never going to grow the ACL back. It's never going to connect again. So you have to have that procedure. But what we want in those types of people is we want after the surgery or during. I'll give you an example. We had a young high school kid that by the time he came to see us had 3 ACL tears. And so they didn't address the root of it. Because he wasn't really even, there wasn't major contact in these injuries, but that ligament kept tearing. And so they would just go repair the ligament, and it would tear again. So there was a lot of disconnects between his brain and cells in and around that stabilized the knee joint. There were muscles there, there's bones there. All those little cells have to have power from the brain. And if you don't keep those cells powered up, then they're weak. So now this kid's fully functional. After his last surgery, could barely squat for a significant amount of time. Now we have him fully squatting, jumping, playing basketball, and he's probably, the likelihood he's going to tear it again is not likely, because we're keeping everything connected properly and making sure that things are working as they should. His scars, they were massive. They've gotten tremendously better. Because the body, those cells now are healthy. Those scars are like disappearing.
Wow. In your clinic, what are some of the most complex post-surgical cases you've seen, and what do they tend to have in common?
The most complex one I think I've ever seen is the one with 17 surgeries. Actually, we've probably seen others that have been that one was really bad, where the last neck surgery had the crater, they cut the infection out. His case was so bad that by the time he got here, that crater made him temperature sensitive. So he had to keep the air in his house at 80.
Wow.
He had to wear a jacket all the time, or a coat. Even when it was like 80 degrees outside, he was freezing all the time. So we were able to reset his nervous system, and now he's perfectly fine. He has no more sensitivity to temperature, and he still has some pains, but they are so manageable without medication.
Yes.
So which is phenomenal in those types of, and he has hardware, plenty of hardware that they put in from the surgeries, plus the crater. So and then we see other cases where maybe they've done other types of surgeries, multiple ones, and maybe didn't get the result they wanted, and they come here and we're able to get them the result. I wish those cases would have come here before, because certainly we could have maybe prevented all that trauma, all those surgeries that they tried, and all that money. I mean, because they spent a lot of money on it as well.
What do these cases expose about the limits of structured-only solutions?
So if people just follow conventional, there's so much more to healthcare than just what your insurance covers. Because insurance is going to cover drugs, injections, and surgeries, and older type therapies.
Yes.
But the advanced, the ooey gooey good stuff that you don't know about, insurance companies don't know about, and they may think it is experimental. But we've been doing this now for so long, and we have so many case studies. It's unbelievable that we've been able to witness, and I always tell people, we don't heal anything, the body does, and we just have been able to witness so many failed surgeries where people come to see us that we're able to just get tremendous results and totally change their life.
Amazing. What keeps you working with failed surgery cases that others may label as untreatable?
We don't give up on people, and the way this body is designed, God's engineering, it always has the ability to heal. Even if you cut your gallbladder out, right, your body's going to spend the rest of its life trying to grow it back. It's just how we're designed. So I personally feel like just about anything in the body is capable of healing. And so, but you got to do the right things. You got to use the right resources. You have to have the right methods. You have to go to the right mechanic. And that's what we are, is we're like electrical engineers in the body, and we're able to figure out where things are not working, where power outages are, and restore them.
What is the most damaging sentence a post-surgical patient can hear during their recovery?
That can go a lot of different ways. If they're paralyzed, right, after the surgery, or they were paralyzed maybe before, and they're still paralyzed after, or they still weak after, they don't feel good after, everything's good. The surgeon comes in and says, man, the surgery went fantastic. Everything's good. You should be really good in a year, or whatever the period, 3 months. And if they're not, it's devastating to them, right? And they feel like, oh my God. And then the surgeon may say, well, we had this one case, I'll give you this example. We had he was 24, I believe, married with a kid, and he had back pain down his leg. So a high-level surgeon did surgery on him. He was worse after. So 4 months later, the surgeon did another surgery, and worse. So this was such a bad case. Then another 3-4 months goes by, they do another surgery. And this is a person that went from working, moving around, doing all the stuff he wanted to do, to in a walker by the time he got here. Couldn't function, couldn't move. And basically by the time he got here, we were able to figure out all the nerves that were off, completely fix him. Now, it took some work, like a corrective phase of care. He's been 100% fine ever since. He couldn't even be a dad, he couldn't be a husband. He was sleeping in his recliner and in a walker. So you can imagine if he would have kept on that conventional path, I don't know where he'd ended up. But luckily he got here and we were able to reverse. So I guess what I'm trying to say is that not to assume that you need surgery for everything, right? Yes. Even if people are telling you it's not, there's always possibilities that maybe you don't know about. And hopefully that's what this is doing for you right now, is educating you on things that maybe you just don't know about. That's the purpose of what we're doing.
What is the most damaging sentence a post-surgical patient can hear during their recovery?
That, again, there's maybe that it's, from the surgeon standpoint, it's 100%. The surgery went great, but yet the person still feels terrible and doesn't feel good. Or maybe there's some a surgeon comes out and is like, oh, you're gonna need another one. I wasn't able to get everything, or you're gonna have to do another surgery, another follow-up, or maybe the surgery didn't go so good. Maybe they're like, it didn't go so good. I cut something that I shouldn't have cut. There's so many things that can happen that are examples, but I'm just trying to cover a few for people.
Well, that is it for today, guys, on our talk about obviously post-surgery recovery or failed surgeries like that. Thank you so much, Dr. Cormier. That was very informative.
Thank you, Cameron. If this conversation resonated with you, then just keep in mind, your body, there's so many more possibilities besides just surgery that you need to be aware of. And we have all of those things, not only for home, which we can offer to you with devices and methods and technologies, where we have a company called Body Chargers that we started that helps people at home. And if you need even more progressive care to help, we have our clinic, which is the Nerve Health Institute, which we'd be happy to help with whatever you need.